The Department of Health and Human Services finalized a rule last Friday protecting healthcare entities that receive federal funding from being required to provide or pay for abortion. HHS stated it is enforcing Section 1557 under the Affordable Care Act by returning to the government's interpretation of sex discrimination according to the biological definition of sex. This clarifies that the federal definition of sex discrimination under the Affordable Care Act does not include abortion. The finalized rule protects a doctor's right to object to abortion and gender reassignment surgery. This news is being viewed by pro-lifers as bringing Obamacare regulations into compliance with long-standing conscience protection rules. Joining us now via Skype is Prudence Robertson, Communications Associate for the Susan B. Anthony List. Prudence, welcome back. This HHS rule change got a lot of attention because of the impact it will have on transgender policy. But the Susan B. Anthony List calls this a pro-life victory. Can you explain why?
Absolutely, Catherine. This is a victory for conscience protections for the American people. What this rule does is it clarifies the definition of sex discrimination not to include abortion. And this was very necessary because during the Obama-Biden era, the administration attempted to redefine sex discrimination to include abortion as a civil right. And abortion is not a civil right. It, in fact, involves the killing of an unborn child, and the taking of an innocent life. That fundamental right could never be classified as the civil right of another person because it denies the unborn the chance to even exercise and enjoy those civil rights. And, furthermore, children are often snuffed out by abortion because of a disability. And while we're fighting to protect these unborn children, it's very important that we continue to state the obvious case that taking their lives could never be characterized or classified as a civil right. So we're very happy and pleased that this rule has been finalized.
Can you tell us more about how this rule change will specifically impact healthcare providers?
Sure, absolutely. So now that the rule will go into effect and be enforced, sex discrimination can never be used as a basis for abortion coverage through healthcare. And that's very important because you and I know, Catherine, abortion is not healthcare. It is, in fact, the opposite of that. And that's the specifics of what this will do.
Prudence, why is conscience protection a crucial part of pro-life policy? Can you speak to that?
Absolutely. As I said before, abortion is the destruction of an innocent human life, and people, especially healthcare professionals who believe that that is true, should never be forced to have to participate in abortion in any way. We've seen examples of this in nurses like Kathy DiCarlo and a Vermont nurse from the University of Vermont Medical Center who were both forced to participate in abortion against their will just because that these industries wanted to make a profit off of abortion, and their supervisors had no respect for their moral beliefs. And at the end of the day, conscience rights are a fundamental aspect of implementing pro-life policy. And it's crucial that while we're fighting to end abortion on all fronts, we stand strong on the issue of conscience because we owe that to the American people who have deeply held pro-life beliefs that should be respected.
Prudence, I also want to get your reaction to news this week that Planned Parenthood formally endorsed Joe Biden for president. What do you make of this endorsement?
Catherine, it's no surprise, unfortunately. Joe Biden, since he announced his candidacy, has been pandering to the abortion lobby. And, for nearly 50 years, he supported the Hyde Amendment, which keeps taxpayer money out of abortion. And now that he's running for president, he has flip-flopped, and he advocates for late-term abortion through the moment of birth, paid for by taxpayer dollars. So it's no surprise. And he really is alienating key voters that are going to be essential to the outcome of this election. Meanwhile, we have President Trump in the White House, and he is the strongest pro-life president we've ever seen. With him, we've seen pro-life promises made and kept. And that's why we are working hard and encouraging every pro-life voter to get out to the polls in November, because like Planned Parenthood said in their endorsement of Joe Biden, this is a life and death election. You know, the lives of innocent unborn children are at stake, and Joe Biden would strip away every pro-life protection that President Trump has worked hard to promote.
That was so ironic that Planned Parenthood called this literally a life and death election. Thank you for that analysis. Prudence Robertson, Communications Associate for the Susan B. Anthony List.
Thanks, Catherine. Glad to be here.